I started the VA 28 years ago. I'm on my 29th year. I'm also the mother of 2 grown adult children and a grandmother. And with my second grandchild on the way, hopefully in February, I'll get to see my new grandbaby. So I started the VA as a registered nurse, and I worked in a small VA healthcare system in Knoxville, Iowa. That's where I grew up as well. So been in the Midwest for many years. And I went and became a nurse manager for a while. I was also a chief of prosthetics. So if any of you have used any equipment, I used to work in the prosthetics department as well. And then eventually I went down to Eastern Kansas, where I was the associate director of operations down there. And then from there, I came up to the Black Hills. And I've been in the Black Hills as the medical center director for almost a year. Excuse me, almost a year now. At the end of January, I joined the healthcare system as their medical center director. So we're at Black Hills. So I work at Fort Meade. I work in Hot Springs. I also visit all of our CBOCs. So I'm all over our healthcare system. So we have a pretty large catchment area, and I try to go visit all the areas that we provide services to veterans. So I wanted to give you a few updates, and then I want to end it with talking a little bit about the PACT Act, because that's something new that I want to make sure that everyone's aware of and understands how to get services. And I'll invite my public affairs officer, Tom Johnson, to give a little bit more information after I'm done speaking. I don't know if any of you have used My Healthy Vet secure messaging, but I just wanted to talk to you a little bit about that. Black Hills was recognized as being one of the top 5 facilities to have 0 messages escalated for secure messaging. And even in the last 4 months, they've continued to have less than 0.04% of their messages escalated. So secure messaging teams, they have 3 business days to respond to you and to manually complete the message. So if this message is not completed in 3 business days, it's considered to be escalated. So our team's doing a really nice job keeping in touch with veterans and making sure that if you message us, that we get you what you need and we get back to you. The workload for the Black Hills VA healthcare system overall has increased by about 6.7%. So we're seeing an increase in enrolled women veterans as well. From 2021 to present, we've seen an increase in women veterans by 16%. So we're pleased with that. And we understand that women veterans make up one of the largest growths in the VA, and we're ready to take care of women veterans. We're seeking to increase our enrollment, so we want to make sure that we're reaching out to veterans and letting them know all the services that we provide. And that's another reason why I like to get out and talk to veterans out in the communities, so you understand all of the services that we can provide to you, and encourage, if you have friends that are veterans that are not utilizing our healthcare system, we want to really encourage them to utilize our healthcare system. We want to provide care and services to any veteran that we have that we're available to provide. And if we're not, then we will send them out to the community and provide care through those means. Which, speaking of the Care in the Community program, I want to talk to you a little bit about that. We have one of the lowest unscheduled consults in Black Hills for care in the community. So we are providing care very timely to veterans who need to be seen out in the community, because maybe we don't provide that service. We're not doing, we're not doing heart surgery at Black Hills, so we know that you need to go out into the community to get that. And we're taking care of those veterans very timely. We're also increasing home-based primary care. So that's where we have a care team that goes out into the community to take care of veterans as well. And we've just increased that through a Office of Rural Health grant that was funded for 3 years. We added a home-based primary care team out in Meade, South Dakota, as well as we have added one in Scottsbluff, Nebraska. And we're also utilizing our home care services And currently, we are going to look at increasing home care services down in our Hot Springs area as well. So lots is going on as far as trying to reach veterans where they want to be seen, to make sure that they have the care that they need, and to take care of them, whether it's in their home, to make sure they have the resources and the equipment they need to be independent as much as possible, or that we have the services in our healthcare system where they want to come and be seen. Our home health care program, we just started that this last year. Started it with 25 veterans being seen in their homes, and we've increased that to almost, I believe it's over 100 veterans now, and we're looking to increase it even further, and we're really seeing a cost savings by that too, and veterans are getting better care. What I'm hearing from veterans through talking to you, through these signals that you probably receive a questionnaire asking, how did we do? How was our service? I'm hearing that veterans want to come to Black Hills to be seen and that they're happy with their care. And if something happens that you're not happy with your care, we want to hear about that too, so that we can improve the care that we provide you, because we know that we need you to come see us, and we want to be the best we can be so that we can stay open and we can provide the best health care for you. We're also looking at ways to encourage veterans to come use our healthcare system through enrollment expos. And right now, we have invited eligible veterans to an enrollment event, and we're able to enroll them right at the event. And we've had much success with that. Over the last year, I believe we've had about 3 to 4 events. And we're able to ask veterans to come, listen to all the care and services that we can provide you, and then get them enrolled in the healthcare system. So we'll continue to do that, and we also continue to depend on all of our veterans to spread the word that we're ready and willing to take care of veterans. I thought I would give a little bit of an update on the Rapid City CBOC. That is the structure that's being built currently. It is about a 45,000 square foot community-based outpatient clinic. And it will have multi-specialties. It'll have about 120 staff that'll be working there. Parking. I don't know if any of you have been to the current CBOC in Rapid City, but it's very small. The parking is limited. Parking will increase to over 300 spaces for our veterans. They're using some new technology in the CBOC to heat and cool it economically and efficiently, called geothermal systems. They've dug wells underneath the ground, and they're bringing up the water to heat and cool it from 50-degree temperatures up to where it needs to be to heat or cool. And that's another efficiency that's built into that CBOC that they're building currently. Also has a 0-grade incline so that veterans who are in have mobility issues or maybe are in a wheelchair are able to be dropped off right at the front and have no incline whatsoever to get into the building. So we're really happy about that. A covered drop off as well for the the elements, the weather elements that might be happening in South Dakota. We're also increasing our access for PACT teams. We have currently 5 PACT teams out of Rapid City. We're increasing that to 8 PACT teams, and we're increasing mental health exams to include cutting-edge technology in mental health with biofeedback services that's provided evidence-based treatment to veterans experiencing PTSD and military sexual trauma. So with that, we're also adding a addition of a women's health services in that CBOC, and that'll specialize in comprehensive care across the spectrum to treat and prevent women veterans. There's multi-specialties in there. They will include audiology, physical therapy, chiropractic. You'll also be able to get your labs at that CBOC, and the goal is that you will have your labs drawn before your appointment. You'll go to your appointment with your provider, and you'll be able to get those results with your provider at your appointment the same day. We also have the capability of doing x-rays in that CBOC. We've added x-ray technology into that CBOC. One addition that we made on our appointment letters is we've added contact information for veterans so that if you have difficulties with transportation, that you can contact different modes of transportation that we have that we partnered with the DAV to provide transportation into some of the rural areas or some of the outlying areas of even Fort Meade or Hot Springs. And since we've done that, it's been pretty, I've gotten a lot of positive feedback that veterans weren't aware that there was transportation options to them. So especially I will say for women veterans, we used to receive about 1 to 2 calls every month for women veterans who needed transportation to get to their appointments. Now we're seeing 3 to 4 calls per week from women veterans that need transportation. So we're really happy about that, and we're continuing to look at that to see how we can meet the needs of rural veterans with transportation issues. All right, I want to transition a little bit and give you some information about the PACT Act and some updates. So, more than 1 in 3 veterans report that they've experienced toxic exposures, such as airborne hazards, open burn pits, Gulf War-related exposures, Agent Orange, radiation, contaminated water. Toxic exposure screens are clinical reminders for nurses and providers and are in place currently to assess veterans for their exposure to toxins. Toxic exposure screening is being offered through your primary care team. We are currently hiring an environmental health coordinator at VA Black Hills, and this position is in HR currently, and they are experts in VA registries. They can connect you with environmental health registries. They're designed for the time period you serve and guide you to information that can help you better understand your exposures and your health. So VA Black Hills has hired an additional 4 comp and pen examiners. 2 of those are in Hot Springs, 2 are in Fort Meade. We've also got a toxic exposure screen navigator that's been recruited, and we're pleased to announce the physician assistant Laura Parsons will serve in this capacity. She will serve as the lead provider, ensuring that toxic exposure screening is offered to all veterans. Our CNP MSA has been onboarded and she's training right now. And at this time, VA Black Hills is performing 25% audiology exams, dental exams, and 50% sleep exams at our healthcare system. All other exams are being outsourced through VBA contracts. And we're currently addressing audiology CMP exams with our VHA partners and looking at our scheduling tool to see how we can ensure that we are doing as many exams for veterans at Black Hills as possible. Because I do hear from veterans that they want to come and get their exams at the Black Hills. They don't really want to go to a contractor. And we absolutely want you to come and get your exam with us as well. With that, I want to invite up Tom Johnson to give you more information, a little more details on toxic exposure and the PACT Act. So Tom, you want to come up?
Well, thank you. I'm going to have to ask everybody for a favor. So my hearing aids are dead. So if you have any questions during this, please speak very loudly. I might have to run up to you and hear from you. But just for my usefulness, who here has heard about the new PACT Act that just went into law? That's excellent. For those of you who don't know what the PACT Act is, it's a very exciting time. Because what the PACT Act has done is open the door of eligibility for hundreds of thousands of veterans and their dependents and surviving spouses. And the key here is also surviving spouses. If that serviceman or woman has passed away, and it could have been due to a toxic exposure that they received in the military, that spouse is eligible for benefits. So, this new law, the PACT Act is law, expands VA home care and benefits for veterans exposed to burn pit and other toxic substances. This law helps us provide generations of veterans and their survivors with the care and benefits they've earned. The PACT Act expands and extends eligibility for VA healthcare for veterans with toxic exposure veterans from the Vietnam era, the Gulf War era, and the post 9/11 era. This is really focused on what Ms. Curnes had said about 1 in 3 veterans have been exposed to toxic substances. And I bet if you think back throughout your time in the military, you're not going to have to think too hard about a time where you came in contact with something that could cause you great bodily harm. And now it's time that we look at that as a factor. If you have a health concern now that might be a contributing factor to that toxic exposure, we need to take care of it. So the components of the PACT Act that are very important. It extends eligibility for VA healthcare for veterans with toxic exposure, again from the Vietnam, Gulf War, and post 9/11 era. VA will improve the decision-making process for determining what medical conditions will be considered for the presumptive status. Now, do we all remember the Agent Orange presumptive list that came out? Is that familiar to most folk? Same things getting rolled into the PACT Act. A whole list of health conditions, hypertension, a lot of forms of cancer, respiratory illnesses, are now in a presumptive list. And if you have been diagnosed with one of these presumptives, and your military service, you fell into a timeline where you were likely to come in contact with Agent Orange, burn pits, or other toxins, you're now eligible to receive that benefit. So it is streamlining the process to take care of veterans and get them the care and the compensation that they earn. Every enrolled veteran, so every veteran in here, regardless of whether you're enrolled in VA healthcare or not, is eligible to receive an initial toxic exposure screening. That'll be done. For those of you who enroll, your primary care team will take care of that when you go in for your appointment, or you can contact them to get that scheduled. For those of you who aren't enrolled in VA healthcare, who aren't actually receiving care from a VA facility, as Ms. Curnes brought up, we have these new environmental care coordinators and toxic exposure screen navigators that you can contact, and they're going to be able to run you through that screen even if you're not one of our patients currently, because that's how important it is for us to take care of you. VA healthcare staff and claims processors, and that's claims processed through the Department of Veterans Benefit Administration, will receive toxic exposure-related education and training. We want to get everybody on the same page. Because on January 1 of this year, claims started rolling through the VBA system for veterans who are exposed to toxic elements. So these are now active. You put a claim in because you think you were in contact with a toxic exposure, those claims are now being processed. I do hear from other veterans, friends of mine call me up and be like, Tom, I don't really want to put in for this toxic exposure because I don't want it to mess with my CMP right now. I don't want it to mess with my monthly benefit. The odds are that 97% is the number that we're going to be kicking around here. 97% chance that your comp and pen percentage will stay the same or increase by putting in under the PACT Act. There's always the opportunity, yes, if you open up your claim, VBA does have to re-examine certain elements. But the odds are that if you put in for this toxic exposure and put in that claim from the VBA, that your claim will at least stay the same, but will likely increase. Sorry, a lot of notes here. It's a big law. Thousands of pages.
Glad you got the condensed part.
Yeah, right, I did. Now, I just want to poll the room. Does anybody want to hear some of these presumptive conditions that are under the PACT Act? Because it's all online. The great stuff about PACT Act, because it's laws, you can find all this information online at www.va.gov/PACT. And that's PACT, Papa, Alpha, Charlie Tango, PACT Act. Or, if you don't want to go online, you can call 1-800-MY-VA-411, MY-VA-411. And that'll get you in contact with somebody who can really talk to you about the intricacies of this PACT Act. So if you're thinking about applying, I really would encourage anybody who is in contact with toxic exposure or these toxic substances that came from depleted uranium, Agent Orange, burn pit, ionizing radiation, dust, diesel fumes, asbestos from working in the shipyards, you name it, it's a toxic exposure. It's covered in this PACT Act. If you've been in contact, get an application. So you can apply again by filling out a form, but really the information is really helpful to find on that va.gov/PACT, because that will have the application process out there. I'm going to go over briefly what a toxic exposure screen will look like. We talked about it a little bit, where you'll be doing that at your primary care, or you can call in. But I don't want everybody to think that this toxic exposure screen is like, well, I'm going to have to take a day, I'm going to have to drive to Fort Meade, I'm going to have to drive to Hot Springs, I'm going to have to wait for the Newcastle clinic to open up and go there on Monday. The initial toxic exposure screen is actually done with your nurse when you check in for your appointment. And they're going to ask you just a couple short questions. Do you feel that you were exposed to toxic substances in your time in the military? If it's yes, done. That gets referred on to your primary care provider. It gets referred on to that environmental coordinator. It gets referred to Laura Parson, who the director spoke about, who is our TES, Toxic Exposure Screen Navigator, and they're going to take it from there. And they're going to give you those consultations. They're going to look at your medical history. They're going to see if you have one of those presumptive illnesses that we talk about, from respiratory disease to cancers, hypertension. It's a very long list of diseases to fall under this. And they're going to get you taken care of. So again, it's literally as easy as calling in. Were you exposed? Yes, no, I don't know. And if the answer is I don't know, we're going to help you find out. If the answer is no, we're going to leave it be. But we're not going to leave it be forever. We're going to come back and we're going to talk to you about it again every 5 years. Because something might have come up. You might have gotten diagnosed with a certain ailment that could have been in consideration for one of these ionizing radiation, Agent Orange, dust, asbestos, and so on. So it's not just a one-stop. This is transforming the way that we think about taking care of your care throughout your lifetime. Before I leave the room, I'm just going to kind of finish up here. So beginning on November 8th of last year, November 8th, 2022, that's when we really started rolling this out. So if you're going into the VA now,